Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Folate is a B vitamin. It's a water-soluble vitamin. It's sometimes referred to as vitamin B9. And it's really important to have sufficient folate. So we're going to go into that because not everybody has sufficient folate. Sometimes because of eating habits, sometimes because of genetic issues, and sometimes in the elderly because they have trouble absorbing it. So folate, the active version, which is called methyl tetrahydrofolate, is needed to prevent cancer. We'll talk about this more later. It's needed to prevent Alzheimer's disease. We'll talk about this in greater detail later. It's needed to prevent heart disease and strokes. Once again, we'll talk about this later. But it's also needed to make normal, healthy cells. So welcome to my episode, Folate for Good Health, and genetic issues with folate manufacturing. My name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the chief scientific officer over here at Invite Health. You can find all of our episodes for free wherever you listen to podcasts, or just visit invitehealth.com/podcast. I think we have over 400 up on our website at this point. Please subscribe and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. And the information on this episode is linked at the episode description. So let's get going. This is interesting stuff, actually. So folate is a vitamin. It's more water soluble than fatty soluble, so you need to get it into your body every day. Now, a lot of people know the term folate, and where does the term come from in the first place? Well, it's ubiquitous in vegetables and green leafy things, so they name it after foliage. And it's well known because it's fortified in foods like whole wheat bread, etc., to prevent birth defects in pregnant women. Without folate, they don't fully form their face sometimes, and they develop cleft palate, or they could have neurotubular problems where the spine or the skull and the brain doesn't form properly. So folate is a vitamin, just like the B vitamin choline. They're both needed to prevent birth defects. So that's why I commonly recommend people of childbearing age who might want to try to have a child, just get on a prenatal to begin with so you have enough folate just in case you do become pregnant, because it's really important in that first trimester, the first 3 months of pregnancy, when you're forming the skull and the brain and the spine, etc. So it's a B vitamin, and folate's a generic term. It can refer to the folate in plants or the synthetic folic acid that's found in most multivitamins and B complexes. But it can also refer to methyl tetrahydrofolate, the active form. So without folate, you could develop very large red blood cells. It's called megaloblastic anemia. So it's needed to create red blood cells. It works with an amino acid called taurine and vitamin B12 and vitamin B6 and iron to create hemoglobin. And if you lack folate, the red blood cells get really big and they don't get into the blood vessels anymore, so you're not getting oxygen delivered that well. It's megaloblastic anemia. So that leads to shortness of breath, because, oxygen problems, fatigue and weakness. And your folate status, besides eating the right foods or taking a supplement, is really influenced by genetic variations in the metabolism of folate. There's an enzyme called MTHFR, and about 50% of all people have a problem with MTHFR. So it's harder for them to take the synthetic folic acid in a multivitamin or the folate in vegetables and convert it into the active form. Now, you can make up for that to a degree by taking a powerful folate supplement, a powerful folic acid supplement, or eating more vegetables. So 50% of people have trouble converting the synthetic folic acid in their multivitamin into methyl tetrahydrofolate, which is bad because then you have a higher risk of cancer and other problems. So many specialists will turn around and just say, well, take more folate or take more folic acid or eat more vegetables and you'll make up for that. That's not necessarily true. There was a study recently in the American Journal of Human Genetics, and it turns out there's hundreds of genes that affect the ability to convert folic acid into methyl tetrahydrofolate. And if you don't make the conversion, it doesn't protect you from cancer or heart disease. So if you have other minor defects, it becomes much more complex and much harder to create the active vitamin. You're stuck kind of at folic acid. So even if you take additional, it may not work well. And the problem is, because we don't know all of these genes, because we don't know all of the carriers, I think it's just safer for most people to get a little bit of methyl tetrahydrofolate. I mean, I really do. I mean, that's what it's coming down to at this point. So what happens if you lack folate? You get an elevated level of homocysteine. Homocysteine is a byproduct of protein metabolism. And the body can handle a certain level of homocysteine, like a value of 12 or less. But once it gets over 12, it becomes toxic. And folate, the active version, which is methyl tetrahydrofolate, is the vitamin that lowers homocysteine. So if your homocysteine is elevated, you have a higher risk for developing heart disease and suffering with a stroke. But you also have a higher risk of cancer. You also have a higher risk of Alzheimer's disease if you're older. You even have a higher risk of developing a hip fracture. So this is actually a pretty serious thing. So again and again, we see these issues. So many people have issues with their genes that they inherit from their parents, where the genes don't work well for converting folic acid into the active form. And some people just don't eat well, so they're lacking folate in the first place. They're not getting the folic acid or the folate in their food. They're not eating their broccoli and their spinach and their lettuce, etc., so they're not getting it. Or they're not eating high-quality foods that might have a little folate even added to them, like certain breads and cereals. Now, if you drink alcohol, that blocks the absorption of folate. And also smoking decreases your folate. So there's 5 things we know of that decreases your folate. A genetic predisposition to having a problem metabolizing folic acid. A lot of people have that. But also people who smoke, people who drink alcohol, that's a lot of people who don't eat right, and everybody pretty much over the age of 58. It's very common to be low in folate over the age of 58. I even did a podcast episode maybe 2 months ago. I think it was 18 different nutrients that are generally lower in older people. So you have to make up for those deficiencies. So one problem with low folate is your fatigue. You have megaloblastic anemia. But then, I mean, if it's long-term, if you're low in folate long-term, you develop heart disease. A review of 80 human clinical trials, even moderately elevated levels of homocysteine in your blood increases your risk of developing cardiovascular disease. See, homocysteine is a byproduct of protein metabolism, and you need folate, the active form, to fully convert homocysteine to what it's supposed to become, like cysteine. It should become cysteine. Or it should become another amino acid called methionine. So if you lack folate, that's not happening. You're not converting it properly. And if homocysteine goes up to a certain level, and it's not hard to accomplish that, believe me, it becomes really toxic to your heart. It becomes inflammatory. And this leads to clogged blood vessels and coronary heart disease, the biggest killer in the world. it makes it hard for blood to flow because your blood vessels are squeezing, so your blood pressure goes up. It thickens your arterial walls, and it really is a big risk factor for heart disease. So having the active form of folate, a little bit of methyl tetrahydrofolate, you don't need a lot, will prevent an increase in homocysteine, and that's really good for protecting your heart. Now, the second problem is cancer. The active form of folate is needed to prevent the first two steps in cancer, initiation and promotion. I once co-authored a book with the director of oncology at the Strand Cancer Prevention Center, and we spoke all about this, that if you lack active folate, there's a higher risk of initiation and promotion. For instance, radiation and then maybe inhaling pollution. Radiation starts to damage a cell. You damage the genes inside the chromosome of the cell. The radiation starts the process of damaging the genes, and then the inhaled pollution finishes it off, and now you have the cancer process. The active form of folate strongly helps prevent initiation and promotion. Once the cancer's there, folate doesn't help anymore. The folate is needed to prevent the cancer. Lacking folate, increased risk of damage to the genes within your chromosomes, increased risk of cancer. Also, the homocysteine itself becomes pro-inflammatory, so we don't know if that's part of the problem in some people. So there are certain risks incurred by a lack of folate, like colorectal cancer, colon cancer, and rectal cancer. There was a pooled analysis of 13 prospective cohort studies. I love prospective cohort studies. They get a large pool of people, maybe 50,000, 100,000, 20,000, it depends, and they follow them for a long time. But they're also taking blood tests and giving them physicals, and they're asking them what they eat, and they ask them what drugs they take, etc. So they look at all these things. Do they drink alcohol? Do they smoke? Do they exercise? Are they overweight? And then they follow them for 5 years, 10 years, 20 years. I love those studies because it gives you a lot of insight into avenues to follow to see what's good or bad for you. Like the Framingham Offspring study is the one that showed that high cholesterol eventually is one of the things that leads to heart disease. So that was a prospective cohort study. So in these prospective cohort studies, it was 13 studies, 725,000 plus people, followed between 7 to 20 years. They found that if you had enough folate, it reduced your risk of colon cancer. I mean, it really was important for preventing it. It wasn't a huge difference, but without it, it's much easier to develop polyps and colon cancer because folate is needed to create new, young, healthy cells. And without it, it's easier to develop a mutation. But breast cancer is another one. Women who have one alcoholic drink a day have a higher risk of breast cancer. Just one alcoholic drink every day increases their risk of breast cancer. It could be a beer, it could be a glass of wine, it doesn't matter. So 3 prospective studies, if you increase their folate intake, it reduces their risk of breast cancer in women who commonly drink alcohol. There's been a lot of studies showing this, actually. There's been a lot of studies. So women who have a drink every day, increased risk of breast cancer, and it's a pretty high increased risk, but getting enough folate absolutely reverses that back to normal. So here's a very large prospective study in nurses. The Nurses' Health Study was 88,000 nurses. Folate prevented breast cancer in women who drank alcohol. And they didn't need a lot. They didn't need a lot. It helps prevent damage to cells. Now, another condition that's increased if you lack folate is Alzheimer's disease. It's the most common form of dementia. You get these plaques building up in the brain, and the plaques destroy the nerves, and you get what we call tauopathies. You get tangled nerve tissue. So they found that folate, well, we know that babies need folate to develop their brain. We know that. Okay, we know that folate is important for brain development, but we also know that folate is important across your entire lifespan for your brain, especially when you're elderly, when people tend to lack folate. For instance, there was a cross-sectional study of elderly women, and elderly women with Alzheimer's had much higher levels of homocysteine and lower levels of folate in their blood compared to healthy women. And there's quite a few studies now that lowering homocysteine with folate helps prevent Alzheimer's And people with elevated homocysteine in their brain, it leads to Alzheimer's. But they also found that it leads to vascular dementia. The homocysteine in the brain is so toxic, it's so inflammatory, that it damages the blood vessels. There's a lack of circulation. So the brain cells are not getting enough oxygen and nutrition and calories, etc., and the brain cells die. That's vascular dementia. So they're finding a connection with that also. They're also finding that the elevated homocysteine in the brain can inflame the brain and lead to depression and anxiety and insomnia. And they're also finding that the inflammation in the brain can radiate to the back of the eyes and contribute to the most common cause of blindness in aging people, age-related macular degeneration of the wet kind called neovascular. So this homocysteine in the brain is highly toxic. Elderly people tend to lack folate. Folate is what lowers homocysteine. They found that elevated homocysteine is connected to Alzheimer's, and when you give elderly people folate and you lower homocysteine, you strongly reduce the number of people who get Alzheimer's. But they also found in people with mild cognitive problems that folate helped them think better. There's a regular level of memory loss called subjective memory loss. It doesn't mean anything. Like you can't remember the name of the book you're reading, or you can't remember the name of the restaurant you went to 2 weeks ago. It's not a big deal. It doesn't mean anything. You might not like it, but it's not a disease. It's just the common forgetfulness and absent-mindedness you see in people in their 60s, 70s, 80s, etc. But then there's a step up, which is toxic. It's called mild cognitive impairment, where the brain has actually shrunk. You're having trouble understanding complex thoughts. Those people generally drift into Alzheimer's. They found that when you gave people with mild cognitive impairment, people at a big risk for Alzheimer's, when you gave them methyl tetrahydrofolate and also some other B vitamins like methylcobalamin B12, pyridoxal 5-phosphate B6, their brains work much better. But even just giving them the B12, the folate, I should say, even just giving them folate was making their brain work better and protecting them and slowing down their loss of brain function. Because eventually they can develop Alzheimer's, and the active folate was helping prevent that from happening. But this is interesting. They found even people with a genetic propensity for developing Alzheimer's, the folate was helping prevent that too. So that's important. So let's talk about that. There's a gene called the ApoE gene in the brain. And what it does, it loads the brain cells with the correct oils, like fish oils and vegetable oils and phosphatides, etc. There's 3 variants that's known of this gene: ApoE3, ApoE2, and ApoE4. Not many people have ApoE2, but if they have that, it very successfully loads fish oils into the brain cells, and that strongly prevents Alzheimer's disease. Then there's a second variant that's much more common, ApoE3. That loads fish oils and other fats into the brain at a normal rate. So it doesn't really protect you from Alzheimer's, but it also doesn't cause Alzheimer's. And most people have that variant. The variant is the form you inherit from your parents. And then there's a third one that's a risk for Alzheimer's. It does a sloppy job of loading important fats into the brain. Don't forget your brain is 60% fats. So you need the fish oils in there, and you need the vegetable oils. The ApoE4 does a terrible job of loading these oils into the brain, and that increases your risk of Alzheimer's. They found even in the people with the genetic propensity for developing Alzheimer's, ApoE4, folate helped prevent them from losing their memory. It helped lower their risk of developing Alzheimer's. In fact, they found when you give people with the ApoE4 variant that can lead to Alzheimer's, that if you give B vitamins, you can reverse their risk back to normal. You can help prevent them from having Alzheimer's. So there are several things that do that. I mean, besides exercise, getting enough sleep, drinking your water, eating your vegetables, all those things are important. But they found B vitamins help prevent that. They found a form of vitamin E called tocotrienol helps prevent that. They found fish oils and krill oil help prevent that. And they found green tea. All of those help prevent people who carry the ApoE4 gene variant that have a higher risk for Alzheimer's. If they took any of those things or ate any of those foods, it helped prevent them from drifting into Alzheimer's. It kind of negated that increased risk they had because of their genetics. So there's a number of studies showing that if you can give these people the active form of folate, you can help prevent the onset of Alzheimer's. You can help prevent cancer. There's also studies that you help prevent depression. You can even help treat depression. And you lower the risk of a hip fracture. Elevated homocysteine is toxic to your hip joint and your bones, and it increases the risk of hip fracture. So here's something simple. Whenever you get a multivitamin, make sure it's not folic acid, and it doesn't have to be a lot. Just make sure it has some methyl tetrahydrofolate in there. And then you're covered. Even if you're one of those people that has the genetic variant where you have trouble creating the active form of folic acid, even if you're somebody with high homocysteine, you can help lower the homocysteine and you can help make up for the genetic variant in your folic. So it's called methyl tetrahydrofolate. MTHF is the abbreviation. So some of the multivitamin companies like us, that's what we use in our multis. So you should look for that. In any event, I want to thank you for joining us today, for tuning into the Invite Health podcast. You can find all of our episodes for free wherever you listen, or just go to invitehealth.com/podcast. Please subscribe and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. And I hope to see you next time on another episode of the Invite Health podcast. And thank you so much for listening. Jerry Hickey signing off.